can barely eat.
Yes. Inalalia hii. Kila mtu unajua ukiuma na hii wezi, lakini nitengeneza iwe maji.
She can barely drink. And if she does, this is what happens.
Nana.
I will take that again, but this time in slow motion. Meet 45-year-old mother of 2 and a divorcee who was diagnosed with cancer of the jaw.
Cancer of the jaw is part of the head and neck area. They are quite common cancers, but they affect mainly people who take alcohol and use tobacco.
In Kenya, cancer is the 3rd leading cause of death after infectious diseases and cardiovascular conditions.
Much of the information that we have around research is based on what has been done in other countries. But we want to understand in our own context what is driving the rising cases of cancer in this country.
Annually in Kenya, we see about 40,000 new cancer cases. Out of the 40,000, we lose a staggering figure of 28,000 per year. So that's a very high fraction. Yeah, like almost 80%, of the people you meet with cancer, they may succumb in that same year to the cancer because of the stage.
So why exactly is there a sharp rise in the country?
Okay, there are many factors, some we don't know. Others include 1, population increase. Okay. Number 2 is changing lifestyle. We are adopting the Western lifestyle. Number 3, the increase in HIV and AIDS pandemic. It predisposes the population to cancer because your immunity is poor. When you have strong immunity, you fight cancer. When your immunity is poor, many things can come to colonize your body, including cancer.
What then needs to be done curatively?
Access has to be improved because not all patients requiring chemotherapy are able to access. As you can see, most of the machines are based in Nairobi, so people have to travel sometimes 600, 700 kilometers away to access treatment in Nairobi. And if I cannot afford to go to Nairobi, really, you are from Wajir, Mandera, or you are from Kisumu, people don't come. Many people don't come.
We appreciate that we need to strengthen our health system, basically, to build more capacity in our health facilities, to be able to provide services to these people. Because when you think about cancer, we need to provide what you call chemotherapy. That's basically the use of drugs. We need to provide radiotherapy, which is the use of X-rays to burn the cancer tissue so that it's removed from the body. So what you're trying to do is basically to build that capacity.
Detection ensures a favorable outcome and prognosis of most cancers. About 80% of the reported cases are detected at an advanced stage, and very little can be achieved in terms of treatment.
I think awareness, early diagnosis and early treatment, screening, so that even if we are picking 40,000 new cancer cases a year, we should actually be saying we are saving majority of them, that they are surviving, they are living with the cancer because they are getting treatment, instead of losing 2/3 of them. As we diagnose, we are losing them.
The media has a lot to do in terms of creating awareness. So when you understand, when you get to know how many people are going for screening, how many people are smoking, when you pass that information, you create awareness. The other critical thing that we are also moving towards is doing local research. So the whole objective of this event today was to formally present to the country our situation in terms of the burden of non-communicable diseases in Kenya. It's a first survey of that kind that has happened in this country, so we are very excited to be able to launch that today, because moving forward, research is also critical to inform us on what are contributing to this so that we are able to address these factors that are causing the rising cases of cancer.
All said and done, the mother of two, who is representing a majority of people living with cancer, is in pain. And despite that, she is hopeful that the health system will improve even as she pursues treatment.
Nana, ndio walisema nianze kuweko dawa. Sasa kuweko dawa hiyo mara 3 ndio dawa ikakosekana.
If you keep skipping your treatment, then actually they say cancer cells, when exposed to radio and chemo, you know, they become a bit, you are disturbing them. So in case you disturb them and stop the treatment, then they'll start multiplying. So we encourage that when you start, they should be kept under control as much as possible without skipping treatment.
Reporting for the Health Channel, my name is Dorcas Karanja in Nairobi, Kenya.